Good morning all. I am Dr. Dimple Parmar from the Department of Pediatric and Preventive Dentistry, Narsibai Patel Dental College and Hospital, Sakarchand Patel University, Bisnagar. So today I am discussing about difference between primary and permanent teeth. So these are the contents that include introduction, dentition periods, general differences, morphological differences in crown and root, pulpal difference, histological difference, difference in mineral content, and conclusion. So starting with the introduction, as we all know, human beings are provided with the two sets of dentition that includes primary dentition and permanent dentition. It is essential to have a thorough knowledge regarding the morphology of primary teeth as well as the differences between the primary and permanent teeth because both are different. So the anatomy of primary teeth resembles in general to corresponding permanent teeth except spatial functional adaptation necessitated by the smaller jaw of the children, as we can see in both the diagram. This is primary dentition and this is permanent dentition. So human possesses two types of dentition, that is deciduous dentition and permanent dentition. Deciduous dentition, number of teeth present are 20, and in permanent dentition, number of teeth present are 32. Here eruption time. So the first deciduous teeth, that is lower central incisor, will erupt at the age of 6 months. So here the eruption time is 6 to 33 months. In permanent dentition, eruption time is 6 to 21 years, as the first permanent molar will erupt at the age of 6 to 7 years. Now the eruption sequence. So in deciduous dentition, first central incisor, then lateral incisor, then deciduous first molar, then canine, and the deciduous second molar will erupt. In the permanent dentition, in maxillary teeth, first permanent molar will erupt, then central and lateral incisor, second premolar, canine, then the second premolar and the second molar. Now in mandibular teeth, the eruption sequence is 6, 1, 2, 3, 4, 5 and 7. So other names for the primary dentition are baby teeth, milk teeth and the deciduous teeth. Now as we can see in the this picture diagram, primary and permanent dentitions are present. So in the primary dentition, first central and lateral incisor, canine, and both the molars are present. In the permanent dentition, central incisor, lateral incisor, canine, premolars and 3 molars are present. Now dentition period is divided into main 3. So that is primary dentition period, mixed dentition period and permanent dentition period. Why it is known as primary dentition period? Because in primary dentition period only primary teeth are present, that is 20. In each quadrant 5 teeth are present, so it is primary dentition period. Now what is mixed dentition period? So in this both, that is primary and permanent dentition are together, so it is mixed dentition. In permanent dentition, only permanent teeth are present, that's why it is known as permanent dentition period. Now we'll start with the difference between the primary and permanent teeth. So it is divided on the basis of 5 factors. So first is the general differences, second will be the morphological differences of crown and root, okay? Third will be pulpal differences and fourth will be histological differences. Fifth is the difference in the mineral content. So we'll start with the general differences between the primary and the permanent dentition. So first is the difference in number, that is 20 in primary dentition and 32 in permanent dentition. Here 2 incisor, 1 canine and 2 molars in each quadrant, whereas in permanent dentition 2 incisor, 1 canine, 2 premolars and 3 molars in each quadrant are present. Now here in primary dentition we do not have any premolars, and in permanent dentition we have 8 premolars. Now only 2 molars are present, that is deciduous first and the second molar. In the permanent dentition, third molar is also present, that is first permanent molar, second and the third permanent molar. Here primary dentition is bluish white in color and permanent dentition is yellowish white in color. So we'll start with the morphological differences in crown. So what are the differences that are present in the crown and root that we will going to see. So in the crown, in the primary dentition, as we can see in the picture, it is shorter, and in permanent it is bigger, Then it is constricted in the cervical portion and are narrower at their necks. In the permanent, cervical constriction is not well marked. Here in primary dentition, cervical ridges on the buccal aspect are more prominent. Here cervical ridges on the permanent crowns are very flat. So here thinner enamel and dentine layers are present in the primary teeth, and here thick enamel and the dentinal layer are present. So enamel rods in the cervical area are directed occlusally, whereas in permanent teeth, enamel rods in the cervical area are directed gingivally. Now, in the primary teeth, broad and the flat contacts are present, and in permanent teeth, point contacts are present, as we can see in this picture. And occlusal table is wider, and in primary dentition, occlusal table is narrow. So other differences include prominent mesiobuccal cervical bulge that is seen in the primary molar. Here we can see the bulge. In permanent teeth, less prominent cervical bulge seen in the permanent molar. Here in primary teeth, incisor have no developmental groove or the mamelons present, but in permanent teeth, incisor have developmental groove or mamelons on the newly erupted teeth, as we can see on the incisor, that is maxillary and mandibular teeth. Now, next will be, there will be less tooth structure covering the pulp in the primary dentition, and in the permanent dentition there is more covering of the enamel and dentine, because in permanent teeth enamel and dentine is thicker. Here show more adhesion in primary teeth, and there will be less adhesion in the permanent teeth. So here all primary teeth shows neonatal line in primary teeth, whereas in permanent teeth only first molar exhibit neonatal line. And the mineral content of enamel is more organic in the primary teeth and less organic in the permanent teeth. So now we'll go ahead with the morphological differences in the root. So as we can see in the picture, roots of the primary teeth are very long and slender, and short root trunk that we can see in the picture. In the permanent teeth, roots are short but robust. Larger undivided portion of the root is present in the permanent teeth. Now here, roots are more divergent and flaring, as they have to accommodate the permanent tooth bud. As we can see in this radiograph, this is primary teeth, okay, primary second molar, and this is the tooth bud, and that have to accommodate the permanent tooth bud. So the roots of the primary dentition or the primary teeth are more divergent and flaring. Then primary teeth undergo physiological resorption. So as the roots undergo physiological resorption, the permanent tooth will erupt. Now in the permanent teeth, roots are less divergent and do not flare to a great degree or the great extent. It do not undergo physiological resorption. Here only pathological changes take place. Now third one is the pulpal difference. So what are the pulpal differences that we can see in the primary and the permanent teeth? So first is the pulp chambers are large. So where are the pulp chambers? So this is the enamel, this is the dentine, and these are the pulp. So this is the pulp chamber which is higher. So pulp horns are higher and pulp chambers are very large. Whereas in the permanent teeth, small size pulp chambers are present and pulp horns are very low, and enamel and dentinal thickness is more. So here purple outline follows the DEJ more closely in the primary dentition, but in the permanent dentition it follows the DEJ less closely. High degree of vascularity and cellularity in the tissue in the primary teeth, and less degree of tissue cellularity is present in the permanent teeth. Here high potential for repair is there in primary dentition because of vascularity, and comparatively less tooth structure is present, whereas in permanent teeth less potential for repair as well as more tooth structure that protect for the repair. In primary dentition, greater thickness of the dentine over the pulpal wall, whereas in permanent teeth comparatively lesser thickness is present. So Accessory canals in percussion area is more, and in permanent teeth, accessory canals are present in the root apices. So in the primary dentition, dentoalveolar abscess is more common, and in permanent teeth, apical abscess is more, periapical abscess is more common. So root canals are ribbon-like in the permanent dentition, as we can see in this picture, and here the root canals are more tortuous and curved. Okay, that is present in the permanent dentition. Now, no regressive changes can be seen in the primary dentition, whereas regressive changes in the form of various calcification or pulp stone are present in the permanent teeth. So this is the picture of the tooth in which we can see the enamel and the dentinal thickness, pulp horn, roof of the pulp chamber, floor of the pulp chamber, orifices, root and the pulp canals, here accessory canals and the apical foramen. Okay. So now in the primary teeth, now we'll go ahead with the histological differences. So in the primary teeth, presence of a cap-like zone of the reticular and the collagen fibers are present. In permanent teeth, no such zones are present. Whereas in primary teeth, enlarged apical foramen, and here in permanent teeth, constricted apical foramen is present. In primary teeth, abundant blood supply is present because vascularity is more. In permanent teeth, less blood supply compared to the primary teeth. Here, response to the external stimuli is typical inflammatory reaction in primary teeth, whereas in permanent teeth, response is by calcification or calcific scarring is present. In the primary teeth, nerve fibers terminate in the odontoblastic region as a free nerve ending, and in permanent, nerve fibers end among odontoblast and beyond the predentate. What are the other features that we can see in the primary teeth? So, density of innovation is less in the primary teeth. So, teeth are less sensitive to operative procedure when we are doing cavity preparation or anything. So, primary teeth are less sensitive. And in permanent teeth, density of innovation is greater. So, we feel more sensitivity. Now, second is the reparative dentine formation, which is below the arrested caries, is more extensive. And here in permanent teeth, it is less reparative dentine compared to the primary teeth. Then here the poor localization of infection and inflammation in the primary teeth, and in permanent teeth, better localization of infection and inflammation is seen. Now we'll go ahead with the mineral content. So what are the differences that are present in the mineral content? So in the primary teeth, enamel and dentine are less mineralized, whereas in permanent, both are more mineralized than the primary. Here neonatal lines are present in the primary teeth, and in permanent teeth it is only present in the first permanent molar. So in enamel, bands of Retzius are less common, but in permanent teeth, bands of Retzius are more common. So what are the features that we can see in the dentine in the mineral content of primary teeth? So first is the dentinal tubules are less regular, and in permanent teeth it is more regular. So interglobular dentine is absent in primary teeth. Here interglobular dentine is present in permanent teeth. Dentine is usually less dense, and here it is more dense, so it is difficult to cut while we are doing cavity preparation or any procedure. So now what are the changes that we can see in the periodontal structure? So here cementum is very thin and of primary type of cementum is present, whereas in permanent teeth secondary cementum is present. Alveolar atrophy is rare in the primary dentition, and it is present in the permanent dentition. Gingivitis is generally absent in the healthy child or in primary dentition, and gingivitis is more common in the adult or the permanent dentition. So this is the picture of the primary and permanent dentition. We can differentiate both enamel and dentine in the primary as well as permanent teeth. In primary teeth, enamel and dentine thickness is very low. In permanent dentition, it is very thicker. Pulp horns are very high in the primary dentition, as we can see in the picture of the primary tooth, and it is very low in the permanent dentition. Then we can see the cementum thickness and the closed root apex in the permanent teeth and open in the primary teeth. So these are all about the differences between primary and permanent teeth. So I like to conclude that primary and permanent teeth differ significantly in the number, size, morphology and function. Primary teeth have thinner enamel, larger pulp chamber and are essential for speech, mastication, aesthetics and guiding eruption of the permanent teeth. Permanent teeth are larger, stronger and build more lifelong function with a thicker enamel and more complex root anatomy. Understanding these differences is crucial for accurate diagnosis if we want to do treatment planning and providing age-appropriate pediatric dental care as well. Detailed knowledge of both dentition, that is primary and permanent, ensures successful preventive, restorative and interceptive treatment in the children. So, thank you.